I'm a geographer by background, so I've got a totally different perspective on this than I think most people. What you can see here is a map of cycling injuries in London from the Stats 19 database. Now, the challenge of this, as Alison outlined earlier, is it's only to do with motor traffic injuries, right? So anytime a cyclist comes off their bike because a pedestrian steps in front of them, or they hit a pothole in the road, it's not captured. So we're already missing quite a bit of data from this kind of database, which is where we get most of our information from when we look at cycling injury and the sort of circumstances around cycling injury. In this map, the lightest coloured areas, the light yellow, are slight injuries. The green are serious injuries, and the red are fatalities. You can see here it quite clearly follows along most of the major roads. But we need to know more information about each one of these so we can do better prevention strategies and find out why people are getting injured in the first place. And this is where the hotspot sort of analysis we talked about earlier could be quite useful, especially building on the data set that Manuel was just discussing. We know something about who tends to be injured, but again, we're lacking a lot of data. So if you look at the Stats 19 database, you get quite a different picture than if you look at the HES data, which is hospital episode statistics. So that's every single injury that comes into the hospital. We know that men are much more likely to be injured than women. So if we look at fatalities, I believe 91% of fatalities last year were men. 82% of injuries overall were men. So we know that men are more likely to be injured, but we also know that in some cases it might be more women who are injured, or in certain circumstances. We need to get more information about different types of cycling injuries. And what we hope to have is some map, like we see here, which shows hotspots. But what kind of hotspots are there? The injuries where someone's been off their bike because there's a pothole that could be easily remedied. Are there more injuries because of roundabouts? Could we look at infrastructure changes? Would these injuries be prevented through helmet use? These are all the kind of questions we're trying to answer, but we need better data again. So the more information we can find out about each specific injury, the better we are. And unfortunately, right now, there's very limited data available. We know perhaps the age, gender, ethnicity, if we're lucky. But we don't actually know many details around the circumstances. That's what we need to have more information on in order to create better interventions and hopefully prevent further injuries. I'll let Graham talk now about the evidence we have from literature, and then I'll kind of sum up with the different projects we've got proposed to injury prevention.
Okay, thank you, Dianna. Yeah, so I'm just going to run over the literature that's available at the moment from studies which have been carried out internationally on what works in reducing both crash risk but also severity of injury. We know that multi-lane roundabouts are particularly hazardous for cyclists. This is actually Old Street roundabout up here, particularly where there's no separate cycle track, and a separate cycle track does make a significant difference. It does reduce the number of crashes which happen, cycle vehicle crashes at a multi-lane roundabout. We know that sharing paths and pavements with pedestrians is risky not only for the pedestrians but also for the cyclists, and significantly increases the risk of injury. We know that separate cycle paths are beneficial and reduce the risk of injury and the crash risk, and we also know that minor roads are safer than major roads. So if you can steer cyclists through minor roads rather than along major roads, then that is beneficial. When crashes actually happen, what reduces the severity of the injury? We know that helmets are beneficial. Something like between 63 and 88% reduction in head, brain and severe brain injuries attributed to helmet use. They also work to reduce facial injury as well, not just head injury. And how to get people to wear helmets? Well, there's a lot of evidence that non-legislative initiatives work in terms of getting particularly children to wear helmets. They work particularly well for the under-12s, and they also work particularly well when the helmets are given out free. There's no evidence that subsidised helmet schemes work in increasing the amount of helmet use, and there is also evidence that legislative initiatives work as well. Finally, interestingly, where the evidence is not so strong, you'd think it would be, but visibility aids. There's actually no trials being conducted into the effect they might have in reducing the number of injuries. They do increase driver awareness, but there's no trials at this stage anyway. There were no trials that had been conducted. And also bicycle skills training programmes. The trials that have been conducted have shown that they make no difference to the number of injuries sustained. Now that might be the quality of the trials, the quality of the data. There could be a lot of reasons, which is one of the things that we're interested in. All this evidence comes from systematic reviews, which are papers where people have put together all the different evidence from different individual trials. But just to finish, the amount of the size of the contribution from the UK to these systematic reviews is minimal. Only 4 studies from the UK contributed to all these different systematic reviews, and those studies required specialist data collection processes, not the routine data that we're arguing, the improved routine data that we're arguing that we need. But I'll hand back to Dianna, who's going to tell you about the projects that we've got in mind to help with this.
Thanks, Graham. Okay, I've been in a fortunate position to be able to talk with some folks at Hackney Local Council. For those of you who don't know, Hackney is a really great cycling area. I don't know how else to describe it. It's got the highest rate of cycling outside of Cambridge, so it's quite unique in this respect. And they're really keen on trying to find out more information about, again, injury prevention, and also how to improve cycling overall. So they've got 2 big projects they've been working on for a while, and I've tried to take on some collaboration with them, and I've outlined 2 smaller projects here. One of them is looking at risk perception among cycling, and this is looking at how children and adults and cycle trainers see the risk perception affecting people's propensity to cycle or not. So we're proposing a series of focus groups which would then feed into a national survey which would hopefully roll out across the UK to gather more information, not just in London but elsewhere, about why people tend not to cycle. Is it a risk of injury? Is it a fear of risk of injury? What are the perceptions following any sort of slight or serious injury, or for adults and children specifically? Then the second one is something that's quite interesting to me as well. It's looking at simulation modelling. So this could be something as basic as regression modelling, but it's actually a suite of models I'm hoping to develop which would take very simple sort of interventions like speed reduction or increased helmet use, or looking at cycle training schemes to see how we might predict these interventions to affect injury rates in certain local areas. And then again, taking these small areas, we've got data with Hackney or the clinicians at the Royal London, and rolling it out further across London and hopefully, again, further across the UK. So those are our 2 projects which we hope to get some support for from you. Thank you.
Yeah, I just want to pick up on the issue of visibility, really, which I talked about in the presentation, and we talked a lot about, particularly on table one, which about the cyclists and pedestrians and cars and how they interact. And I think there's an issue 2 ways, the kind of cyclists we see by both pedestrians and by cars, and also the visibility from the cars or the lorries or the buses. So I think there's work to be done on this. Just to stress that what I said earlier, it's not that there's no evidence that visibility doesn't work. It's just that no one's looked at this. There's no research into this. So I think there's a lot of work to be done looking at the issue of visibility from the cyclist point of view and also from the motor vehicles point of view.
And I think one of the things we talked about was infrastructure quite a lot and how difficult or not it should be to change infrastructure. We see sort of changes already taking place for areas that are pedestrianised, so like the movies for pedestrians. And we'll see examples from abroad where they've taken cars out of the centres of areas, centres of cities, and of course, injuries drop. So we should try and look at more work towards this. And again, make use of our modelling to say, okay, we know what injuries look like in areas where we've got cars, we know what injuries look like in areas where we don't have cars, on busy roads versus less busy roads. And take into considerations for cyclists actually not to cycle, what's efficient and useful for them as well. So we need to consider things like this as well as making better use of data we have already. Because we do have some good data. We've got pretty good data sets. We're building better data sets here, so we can make use of this again to look at how we can better prevent injury through cycle training perhaps, or more helmet use, and try and test out a few of these interventions first in small areas and try and roll them out further from there in the ideal world. Thank you.
But there's very fertile material here, which I think if people knew about, would produce change. So thank you very warmly for your participation. Thank you for the Barts charity